Good afternoon. I'm going to illustrate the results of a study which has the aim to verify pain proneness in migraine patients. This is the disclosure of my conflict of interest. Well, what we know from several years is that nociception is something really complex. Indeed, in addition to the nociceptive activation, pain is also considered an individual and internal experience which is consciously perceived, modulated, and transformed according to the emotional context. The complexity of pain is indeed nicely represented by the fact that four broad different categories have been identified to describe it. We talk about nociception, we talk about perception of pain, we talk about pain behaviors, and we also talk about suffering. Among those living with pain, some individuals seem to have specific characteristics which were described for the first time by George Engel in 1959 in a seminal paper published in the American Journal of Medicine. He said that some individuals have unusual intensity and frequency of pain, and commonly there is not a through correspondence and correlation between the presence, absence of a peripheral disorder, which might explain pain, and the presence, absence of pain. Engel calls this kind of patient as pain-prone patient, and this concept has been later refined in another seminal paper, this time by Blömer and Heilbronn in 1982, in which they describe the clinical features of the pain-prone patient. Well, according to this paper, a pain-prone patient has a consistent level of hypochondriacal preoccupation related to the painful body part. He has the image of himself as a solid citizen, which means a strong deny on difficulties in interpersonal relationships and in describing family relations in idealized terms. In addition, the pain-prone patient views himself as an independent person, has a history of working, excessive work and restless activity prior to the occurrence of pain. Usually there is no more initiative after the onset of pain, and is a person with family and or personal history of depression, alcoholism, abuse, and chronic pain. Well, interestingly, this concept seems to be in part present also in the literature concerning headache, since this paper from 1995 talked about headache-prone individuals. And what they found is that headache-prone individuals are subject prone to manifest headache, but they also have high level of hypochondriasis, depression, hysteria, psychasthenia, and social introversion. Well, considering this background, we wanted to study pain proneness in patients with migraine. In particular, it seems to be interesting since it is not already present in the literature. First, to verify whether pain proneness is more prevalent in patients with different level of severity of migraine, that is chronic migraine and episodic migraine, if compared to healthy subjects. But this objective will not be developed in this presentation, so you can find more details on these results in this paper published in CNS Spectrums. And the second aim is identifying among pain proneness dimensions those which can be potential risk factors associated to the condition of migraine, which will be considered in detail in this presentation. Well, we run a cohort study in outpatient migraine, in outpatients with migraine, referring to a third level facility in Florence. For the present presentation, we considered 300 consecutive subjects, among them 10 with chronic migraine, 100 with chronic migraine, 100 with episodic migraine, and 100 with healthy subjects. They were matched for age and sex. Overall, we had a mean age of 43 in the sample, and 80% were females, since migraine is more represented in females. And in order to measure pain proneness, we used the checklist proposed by Blömer and Heilbronn to perform a brief clinical interview, so that at the end the answers given to the checklist are on the format yes, no, so present, absent. Well, the checklist and, as a consequence, the brief interview evaluated some specific domain of pain proneness, somatic symptoms, which include continuous pain of obscure origin, hypochondriacal preoccupation and desire for surgery, solid citizen, which includes denial of conflict, idealization of self and family relations, and ergomania pre-pain, depression, which includes anergia post-pain, anedonia, insomnia, depressive moods, and despair, and also family, the history of the individual in terms of family and or personal history of depression, alcoholism, abuse, chronic pain. I'm going to present you here the results of multiple logistic regression analysis. All the three analyses I will present have been adjusted for several psychological variables in order to have a clearer picture of the results. So when we compared chronic versus episodic migraine patients and healthy subjects, we found a statistically significant difference, or at least a significant confidence interval, only concerning the domain history, so the family personal history of this subject, with an odds ratio of 2.45. When we evaluated the condition of being of having chronic migraine versus being healthy, we found that the dimension solid citizen and the dimension on depression, on the contrary, had odds ratio above 3 with meaningful confidence interval. So apparently presenting pain proneness in terms of depression and solid citizens might increase the probability of having chronic migraine. And similar results were found when we compared we evaluated episodic migraine subject versus healthy subject. Once again, the domain solid citizen and the domain depression had high odds ratio, respectively around 4 and 2, with meaningful 95% confidence interval. While when we run the analysis using as a reference chronic migraine versus episodic migraine, no odds ratio with a significant confidence interval were found. So based on this study, what we may say is that migraine is for sure an unpleasant sensory and emotional experience associated with psychosocial manifestation that might contribute to the level of suffering of patients. But we may also conclude that the pain which characterizes migraine may acquire an affective tone that contributes to create a psychic signature, that psychic signature, which was for the first time mentioned by Engel, having specific psychological and social characteristics. So like something like an imprinting, something like this psychic signature, which can increase the vulnerability towards migraine itself. Thus, we may conclude that patients with migraine might be qualifiable as migraine-prone individuals. Thank you for your attention, and if you have doubts or questions, do not hesitate to contact me.